Dr. Senthil Kumar, Department of Agricultural Engineering, SNS College of Technology. Today, let me present the case study on the milk adulteration with melamine in China. The crisis that is happened as well as the responses taken by the government. Let me discuss in detail. And to say about the introduction, the milk and the infant formula adulterated with melamine has been a high concern since September 2008. Several companies, including some dairy giants in China, implicated this scandal, especially the Sanlu infant formula milk products that has made nearly 42 lakh 94,000 babies sick with nearly 51,900 hospitalization and 6 infant deaths by end of November 2008. This melamine milk crisis not only damaged the health of those infants but also caused a great economical loss in the food industry. This case study introduced the background of the use of and production of this melamine in China. The analysis the reasons why the adulteration happened and conclude the impacts of the crisis and the responses of the China government. Finally, the lessons planned, learned and further improvement on food safety will be discussed in this video. Let us see about the background, what is melamine and why it is adulterated with milk. Let us see the background. So melamine, that is a C3, has 6N6, is an organic base with high nitrogen content, nearly 67% of nitrogen by mass. So it is a trimer of cyanamide with many industrial uses. It is combined with formaldehyde to produce melamine resin, a very durable thermostatic resin used in formica and melamine foam, which is a polymetric cleaning product. The end product includes countertops, food containers, fabrics, glues, housewares and retardants. It is also used in fabrication of melamine polysulfonate as a super plasticizer to make high resistance concrete. Melamine is also a major component of a pigment yellow 150, then fertilizers and derivatives of arsenical drugs for the treatment of African sleepiness diseases. Now let us see the production of melamine in China. China melamine production started early in 1958 and increased with an average of 22.8% in the period of 1980 to 87. Between the late 1980s and the early of 2000s, both consumption as well as the production of melamine grew considerably in China. Currently, China is the world's largest exporter of melamine and its domestic demands reached around 2,50,000 tons in 2005 and keep growing by 10 to 20% annually. Between 2002 and 2007, while the global melamine price remained stable, a steep increase in the price of energy sources has reduced the profitability of melamine manufacturing, which has already caused many melamine manufacturers to reduce the production. Why did people add melamine to milk? What's the reason? Let us see what's the reason why they are adding or adulterating the milk with this melamine. The main reason for adding melamine into milk is to increase this protein count at less cost. That means when it is added to milk, also when we are going for testing, it will be very rich in protein. At the same time, at the very low cost, it can be achieved. Standard tests like Edgedal and Dumas test estimates protein level by measuring the nitrogen content. So such tests can be misleaded by adding nitrogen-rich compounds such as melamine. Farmers and producers can dilute the milk but still meet the requirement of high protein content by adding melamine, which makes more benefit. Moreover, such concept that melamine has no toxic effect to human encourage the adulterants, including farmers as well as the milk collectors, to add melamine as a fake protein. Let us see the toxicity of melamine and its appearance in food chain. Melamine first occurred in food chain during the 1950s and 60s. The use of melamine as a fertilizer of crop has been investigated in the early of 1915s. Melamine used as a non-protein nitrogen for cattle was described in the patent issued in the year 1958. Because melamine resin is often used in food packaging and tableware. Melamine results at ppm level in food and beverages has been reported due to the migration of melamine containing resins. Nonetheless, intake of melamine from the consumption of meat and eggs from the animals inadvertently given animal feed contaminated with melamine, and the analogs are very unlikely to pose a human health risk because of low tissue concentrations. In 2008, Chinese milk contamination. Let us see about the contamination of milk in the year 2008. In September 2008, several dairy manufacturers were implicated in a scandal involving milk and infant formula which has been adulterated with melamine, leading to the kidney stones and other renal failures, especially among the infants. In China, many raw milk producers are small household farmers who are eager to maximize the milk production yield under the pressure from low price and rising the grain price. Because the government has set standards to milk nutritional contents, especially to infant formula with high protein contents were required, farmers preferably add melamine to milk to meet the requirement of at very low cost. Except farmers, the middleman between the milk producers has been collecting the substandard milk at low price. They are adding the melamine to milk and selling the tanned milk at high protein milk to the dairy companies at very high cost. This impact of melamine milk crisis. The melamine milk crisis has caused another earthquake in a single word. You just assume describing using the word, it is earthquake. It is similar to earthquake. This crisis is similar to a earthquake in China. The impact of crisis include health damage to infants and great economical loss for the dairy farmers, companies and the country. Infant hospitalized from the tainted milk. By the end of 2008, at least 6 babies died and more than 2,94,000 children suffered kidney and urinary problems by drinking the formula contaminated with melamine. As in late of November, 861 babies were still hospitalized. According to the statistics, 99.2% of infants are younger than age 3, only 0.8% were older than 3, and none of the children were older than 4. That means infants got affected by this adulteration. Response to the China government. China State Council, the cabinet incited a first case national food safety and emergency responses to deal with the tainted Sunlu milk powder incident. The State House Council has set up a national leading group comprising of officials from the Health Ministry, the Quality Watching and local government to deal with the incident. The measures taken are let us see what are all the measures taken by them. Organization of medical team to diagnose and test the calculus in infants in time throughout the country and compensation schemes for the sick persons. A thorough overhaul of dairy and feed makers investigated. Establishing a new regulation and new standards for the milk. Protection of the dairy farmers' benefits. Protection of the right of customers. So lesson what we learn from this adulteration of milk with melamine. The melamine milk case exposed many weaknesses in food safety, supervisors and the market management system in China. And lessons should be drawn from both parties, that is the government as well as the food industry. In brief, ineffective supervision, untimely self-regulation to the emerging crisis by enterprise, low awareness of food safety and non-standardized production. These are all the reasons or the main weakness. The main reason for ineffective supervision in the ineffective food safety control system. Too many departments are in charge of food safety, which cause overlapping of responsibilities and create problems for law enforcement, and there often or conflict of interest within the agencies and the governments at various levels. And let us come to the conclusion. The future work is still required. Several areas has been identified for development, such as to strengthen the coordination and they reduce the overlap in the multi-agency food safety control system in China, to improve the monitoring network by better integrating the efforts of different departments and laboratories, to separate agencies' responsibilities to enable them to carry it out independently without potential intra-agency conflict of interest, to strengthen the management of melamine and other forbidden inputs via tracking and tracing throughout the supply chain management, and to assist farmers in a proper use of such inputs, whether it is need or not, and whether it is to be added or not, like that. To strengthen the enforcement of regulations by forcing on eliminating the conflict of interest at the local level, combining with more surveillance on farms and in local market. And the references to say these and all the various papers, journal papers that I have gone through for preparation of this case study. Thank you for watching this case study. Thank you all.